Hi guys, my name's Danielle. I'm an ITP patient. I've had ITP for 5 years and I'm the founder and CEO of ITP Australia. Our key objective at ITP Australia is to communicate with patients and facilitate communication between patients and the various stakeholders as well, whether that's clinicians, patients, politicians. Our job is to make sure that our ITP patients have a voice and that they're heard and that they're actually considered when decisions are made. One of the most rewarding parts about ITP Australia and being part of the organisation is being able to provide patients with information, but also hearing the relief, seeing the relief on their face, and empowering them to, ask questions and learn more about ITP, and ask questions of their GPs as well, and their haematologists and their clinicians. Some of our patients want to get second opinions, which is okay too. I think that that's important, that patients feel safe and they know that they're getting the right information at the right time, and because they're the ones living with this disease, they're the ones that have to live with undergoing these treatments, whether it's end plate with injections or an oral medication, whether it's corticosteroids. They're the ones that are impacted by this, and it's really important that we provide them with accurate information, the whole picture. Unfortunately, like with social media and with the World Wide Web, sometimes you only get part of the picture. Our job is to make sure that they're getting the whole picture to then make an educated decision. One of the recent conversations I've had with a patient is that her clinician wasn't explaining things properly, not in layman's terms anyway. And this is one of the things, is we can sit here and talk about thrombocytopenia and L-Trombopag and all of these words and all of these names that I've become really familiar with through the charity. But you have to remember is that patients have never heard these words before. Patients have never encountered ITP before. So you've really got to, for lack of a better word, dumb it down. 12 months ago, I was lucky enough to be invited to become part of the ITP International Alliance and attended the meeting in Washington, DC last year. For me, the initial reason for starting the charity was just to provide information. After attending that meeting, I realised that there was so much more to do around support and advocacy and helping patients, whether it be one-on-one or in giant groups. So I have hit the ground running, and we are doing so much more. We've had patient meetings, patient conferences. We're now holding virtual patient meetings, whether they be one-on-one or with 6 or 7 patients at a time. And we find that when patients come together and talk to each other, and we can facilitate that, they are leaving well educated. They're feeling connected with other patients because they don't generally find or have access to other patients any other way. Many patients go months, if not years, without meeting another ITP patient. So holding these forums is a great opportunity for those patients to not feel alone and not feel isolated. And one of the other things that that I love is being able to reassure patients and work with patients one-on-one to let them know that it's going to be okay. ITP Australia is partnering with Rare Voices. Rare Voices is an organisation that brings together rare diseases to provide them and us with a voice, and a much louder voice than what we could ever do by ourselves. We're currently providing a submission for a parliamentary inquiry to ensuring that we can get treatments that are readily available for other diseases to our patients, but not just to our patients, but to other rare disease patients as well. I think it's important that ITP Australia isn't just working towards treatments for our patients, which is a priority of ours, but that we work to benefit the greater good and to help others as well and help them take a step up when they can, because it's important that if we all work together, that we can achieve so much more. We can't do what we do at ITP Australia without your support, whether it's the information you provide us, the feedback you give us, or funding. We are selling pins, these ITP awareness pins. Pins will obviously help us raise awareness not just amongst patients but amongst clinicians and all other stakeholders, and all of the money that we raise from the sale of those pins goes towards helping patients and providing them with the information and the support and the advocacy that they need to improve their quality of life and improve their patient journey. If I can leave you guys with just one last bit of advice, it's, let the patients know that they're going to be okay and that they're not alone. Send them to the website, itpaustralia.org.au. Go there yourself and have a look around and let us know if you think that we can be doing something different or need to make some changes. But the most important thing from a patient is that they need to know that they're not alone. Send them our way. We're on social media, we're on Facebook, on Instagram. My mobile number is available, my email address is available. We want to hear from them and we want to make sure that they're not isolated and they're not alone. But more importantly, that just let them know that it's going to be okay.